So I talked a little bit about clinical trials. I'm going to talk a little bit more about this now. This can be a very important part of any patient's disease journey. And clinical trials are really very important to move the myeloma field forward. They're very important because all new therapies must be tested in clinical trials before they're approved for use in patients. And patients who volunteer to join clinical trials are responsible for the large amount of progress that we've seen in treating myeloma over the past decade. So we've seen quite an impact of clinical trials in myeloma, dramatic improvements in survival in less than 10 years. Survival rates have nearly doubled. We've had many new drugs approved in the myeloma space since 2003, and many new drugs are currently being studied in clinical trials, as Dr. Kumar was discussing. So understanding that the biology of myeloma is improving with the eventual goal of being able to personalize treatments for every patient based on their own personal disease. So this is why clinical trials are important. And it's really great when patients like yourselves might find themselves in a point of their disease where a clinical trial might be appropriate for them. So there's many benefits of clinical trials. You'll certainly receive the normal standard of care in terms of your office visits, your lab work, et cetera. None of that will change. In fact, you might even have additional care and investigation as part of the clinical trial. You will certainly see your healthcare providers and have a research coordinator involved in your care. So there's going to be a lot of people paying attention to you and to the treatments that you're getting and to the outcomes of those treatments. So it can be really exciting. And you might even have a higher standard of care than normal because of all of these people who are watching and who are making sure that you're getting the best possible care in the clinical trial. There's a few things to consider before joining a trial. Certainly, you need to talk to your doctor about eligibility. Each trial has eligibility criteria, and they can be somewhat complicated and confusing, so it's important to talk to your doctor and also with the research nurse to learn more about eligibility and whether a trial might be appropriate for you. And then once you just think that you might want to join a trial, carefully review the informed consent paperwork. So the informed consent is usually a very long form that describes in great detail what the trial is, why it's being done, and what you will have to do when you're joining the trial, and certainly including the number of times you're going to have to go to the doctor and the type of testing that you will have to undergo. And always remember that even if you sign the consent form and join the clinical trial, if you decide at some point while you're on the trial that it's not for you, at any time you can stop and leave the trial. So that's always a consideration. Okay, so sometimes finding a clinical trial that might be appropriate for you can be daunting as well because there's many, many clinical trials out there and it's really difficult to know which ones might be appropriate. So there's a number of steps that you can take to find one that might be appropriate. Certainly, if you're interested, talk to your treating hematologist about any trials that might be available in that center or a center near you. Check with any academic medical centers that are close to your home to see if they might have something that might be appropriate. Both the NCI and the NIH have very good websites where you can look for clinical trials. And we also have a trial finder where you can search for clinical trials on your own, or you can call our nurse navigators to help you sort of dissect what's available. And here is a screenshot of what our clinical trial finder looks like on our website. So I've got the web address there. So if you ever want to come back and go through this presentation and check out this website, you can do that. So you can search by keyword and you can narrow down the choices by the distance that you might have to travel, the status of your myeloma, your prior treatment history. You can narrow it down by a number of different factors. So in this particular case, what I was looking for were trials that involved daratumumab, which is one of the monoclonal antibodies that Dr. Kumar had mentioned, and you can see that there were 58 trials found. So there's some good information on some of these clinical trial finders, so that can be helpful to you, but certainly it might be easier just to talk to one of our nurses.